Welcome to my YouTube channel. Today we are going to talk about treatment of drug-resistant TB. We'll start with monoresistant TB. Monoresistant TB is where you have resistance to one of the drugs in TB. So for example, you have resistance to isoniazid, you have resistance to pyrazinamide, among others. So when you have isoniazid monoresistance, so just to brief you, when you are watching this video, you must be knowing how we treat TB. You must be knowing the first drug we use to treat TB and some of the second line drugs. So the first line drug is isoniazid, rifampin, ethambutol, and pyrazinamide. So the second line drug include mostly fluoroquinolone, amikacin, among others. So isoniazid monoresistance, if you have isoniazid monoresistance, you can have two options. So you give patients daily rifampin, ethambutol, pyrazinamide plus fluoroquinolone. So in short, you'll just have replaced the isoniazid with fluoroquinolone. That could be levofloxacin or more. This is more moxifloxacin for 6 months or 4 months after culture conversion. So I hope we are all together with that. Option 2 is if the patient does not tolerate pyrazinamide, which is highly hepatotoxic and also hyperuricemic, then a regimen consisting of rifampin, ethambutol, and fluoroquinolone could be used for 9 to 12 months. So when a patient is resistant to rifampin alone, should be treated as multi-drug resistant. This is because rifampin resistance is a surrogate for multi-drug resistant because on itself it's very rare. So the next drug is pyrazinamide resistance. Patients with monoresistance are treated with isoniazid and rifampin for 9 months. And most of these isolates of monoresistance reflect on Mycobacterium bovis, which is the reservoir is cow. And how do we get it? By ingestion of contaminated cow milk. So monoresistant ethambutol or streptomycin, or maybe second line, are of little clinical significance, and patients with disease caused by this isolate may be treated just with drug sustainability TB, that is the 4. I hope you are okay. So we've said if patient has isoniazid monoresistance, you just remove the isoniazid and replace it with levofloxacin, and then you can go for 6 months, and then if you have for 6 months or 4 months after culture conversion. Culture conversion is where you had positive culture and now they are negative. And option 2, if the patient cannot tolerate pyrazinamide, then you replace it with you just remove it and you continue with the drug the regimen for 9 to 12 weeks. Rifampin, you said we treat it as multi-drug resistant. We're going to talk more about that. Pyrazinamide, we said you just monoresistant, we just treat it with isoniazid and rifampin for 9 months. Next, treatment for polyresistant TB. What is polyresistant TB? Polyresistant TB refers to TB caused by an isolate of Mycobacterium tuberculosis that is resistant to more than one of anti-TB agents. Isolates may be resistant to either isoniazid or rifampin, but not both. So when you have resistance to rifampin and isoniazid, it may be some other drug that is multi-resistant TB, not both. So you can have isoniazid and ethambutol, or you have rifampin or ethambutol, or rifampin and pyrazinamide, but not isoniazid and rifampin at the same time. So patient with TB resistant to isoniazid and ethambutol. Now we are going one by one, and of which we said rifampin we treat it as multi-drug resistant. So we're just going to deal with isoniazid plus other drug. So patients with isoniazid and ethambutol should be treated with rifampin, pyrazinamide, and so just remove the 2 of the drugs, and then you add a fluoroquinolone, and you lengthen the period that is 6 to 9 months. Patients with isoniazid and pyrazinamide should be treated with rifampin, ethambutol, fluoroquinolone, that would be either levofloxacin or moxifloxacin for 9 to 12 months. So when you have resistance to pyrazinamide, just remove the pyrazinamide, and then you just add a fluoroquinolone, and then you lengthen the period to 9 to 12 months. Patients with resistance to isoniazid, ethambutol, pyrazinamide should be treated with rifampin, fluoroquinolone, and and one or two other additional or oral agents to which isolate is susceptible to, which include linezolid, clofazimine, or use of bedaquiline, which I'm going to talk more about. So if a patient is resistant to the three drugs, then you just do rifampin, fluoroquinolone, or one or two of the drugs that you have mentioned above, and then you do them for 9 to 12 months. And then lastly, we are going to treat treatment of multi-drug resistant TB or resistance TB, or sorry, extremely drug resistant TB or drug resistant TB. So all of this in addition to rifampin monoresistant TB, which is said is rare. So if you get rifampin monoresistant TB, you treat it as multi-drug drug resistant TB. So there are two regimens where you have abbreviated regimens that run from 6 to 12 months, or you have longer individualized regimens that all of them are oral regimens that is 18 months. So the abbreviated ones would be PBL or PBLMN that we're going to talk about more. That is, you treat the patient with bedaquiline, protamide, and linezolid. That is the first drug. This is the more preferred drug, or that is the PV and linezolid. And then, or you treat the patient with bedaquiline, protamide, linezolid, and moxifloxacin. You just had amoxifloxacin. So each you all administer them for 6 months, or alternatively, you could also do dilamide, linezolid, fluoxacin, and pyrazinamide for 9 months if you don't have bedaquiline-based regimens. Thank you.